a very good evening in India and a very good afternoon in UK. So today we have very interesting guest and we would be talking about hormones, nutrition and a lot of things. How much fiber to eat and which diet to follow, keto, paleo or gluten-free. There's a lot of confusion and we all get fascinated with a lot of new things whatever is in the market. So let's find out these things and talk more about hormones with today's Dr. Leah Austin. So Dr. Leah Austin is a private general practitioner, a nutritional therapist based out of London. She specializes in supporting chronic health problems, digestive health, hormonal health, bioidentical hormones, women health, weight problems, nutrigenomics, and anti-aging, as well as optimizing general health and preventive medicines. So yes, that's a lot of things. I'm sure the conversation would be interesting. We are waiting for Dr. Leah. Dr. Leah, if you are there, kindly join in. Says waiting for Dr. Leah. Hi.
Hi.
How are you?
I'm good. How are you?
I am very good. Thank you so much. I know
Good.
we got a little bit of hinges while joining, but thank you so much for taking time for today's conversation. It's a pleasure to talk to you.
Thanks for having me. Thanks for having me to talk on here. It's great to meet you.
Yes, I was going through your Insta live, which is very informing as well. So that's what we decided. Let's do one for our people in India, and let's talk more about hormones and diet and nutrition, everything. So I have given a bit introduction about you. Why don't you tell something about yourself to our audience today?
Well, I'm Dr. Leah, and I'm a GP and I'm a nutritionist in London. And so GP would be a family doctor. I presume I don't know whether you have the term GP in India, but it would be a family doctor or internal medicine in the US anyway. And I studied naturopathic nutrition after I qualified as a GP. And then now I amalgamate the two and I integrate the two. So I manage people and find the root cause of their problems and at least offer them a different path. So there may be, let's say it's a typical medical problem, then you may want to look at the root cause if they're getting recurrent infections or there's something going on there. If you're needing antibiotics every year, then you might want to consider, okay, is there something going on with my immune system? Why am I needing antibiotics every year? And you've got the side effects of the medication as well. So something to consider.
Yeah, that's true. In fact, for that matter, Dr. Leah, even, I have also done my medical, and after that, because there was not a lot of scope with health and with my health as well. So, I discovered and I did diploma in integrative and now doing nutrition during the lockdown, again, a diploma course. But yes, I have seen that, doing some lifestyle changes and health and with so nominal minimum thing, you see a huge benefits out there. I mean, it is very effective. So Dr. Leah, we have some questions from our audience, which has started flowing in already. And I have received some in my DM, which we have noted down for you to, have a quick conversation. Starting from the first one, which is, for our senior citizens, that how much fiber do they eat and how do they add fibers in their food? Because, with age, the metabolism really gets difficult. So what is your recommendation and how do they add fibers in their diet?
That's a great question. So I think it starts with understanding your body, because everyone's body is slightly different. And if you want to be looking at your stools, so making sure that you've got regular bowel movements every day and making sure they're nicely formed. So formed meaning they're soft, but they're not too soft and they're not too hard. And it needs to be daily, and it needs to be a nice, good amount rather than just a small little amount in the loo, like a string. You don't want things like that. You want a nice formed stool bowel movement, and that's so important. And if you're getting daily bowel movements and it's nicely formed and soft, then you're probably getting the right amount of fiber already. However, if you want to look at good, healthy approaches to getting that a good amount of fiber, you want to be looking at things like, vegetarian, lots of vegetables. So I'd say try and aim for 3 or 4 different types of vegetables with each meal, making it a rainbow color. Pulses and beans and lentils are all good sources of fiber as well, but make sure they're cooked properly, because if you don't cook them properly, then they could be difficult to digest. And I always say add in 50 to 75 grams of cruciferous vegetables, which are your broccoli, your bok choy, your cabbage, your kale. They're really good for the immune system and liver detoxification, and also bowel movements and fiber. However, some people can't handle that much fiber because they can get bloated and uncomfortable. So everyone's slightly different, but if you are getting bloated with eating that type of meal with loads of veggies, and you're not having regular bowel movements, then it's something it's important to get checked with your health professional and find out what's going on in your digestive system.
Correct. And what do you suggest about, vegetarian and vegans who have a bit of problem in digesting vegan protein like pulses and all? Have seen a lot of patients of mine who have this kind of issues with the bloating. Do you suggest them some digestive or what do you recommend in general?
If they're having bloating, well, I think it's important. You can take a history, and I guess it depends where you're getting the bloating. If you're getting the bloating higher up, or if you're getting it lower up, obviously everyone's different. I do like to do a functional stool test, but obviously there's a little expense with that. So with some patients, I talk them through their history as long as their medical tests have been normal. So making sure that you've tested something called a calprotectin, which is in the stool. You can, and that's an inflammatory marker. So if that's raised, it could be something like an inflammatory bowel disease like Crohn's or ulcerative colitis. If that's normal, that's reassuring. But I'd also check blood tests and maybe a culture to check there's no bacterial infection. And the other thing is you can test elastase. So that's a digestive enzyme to see if you've got enough elastase, and that helps break down protein. So it really depends on that person, but you need to advise, I think, with each meal, you can look at it from a naturopathic and nutrition approach, making sure that, you smell your food, you chew your food really, really well, you taste it before swallowing, because, these days people are already, and sit down and sit upright.
Absolutely.
These days people are rushing around, right? They're eating on the go, they're eating at the desktop, on the computers. So it really can affect our digestive system that way.
That's so true. In fact, Ayurveda says to be mindful. Ayurveda, which is an Indian practice, it says that to be mindful while eating, and how to do that whenever you're sitting down with your food in front of you, switch off all the distraction and just give a small prayer, small gratitude. So what it does, it calms down your cortisol, and it starts secreting all the digestive enzymes, when you know that there is no flight or fright thing. And also, also it says, like you said, that, observe the food, watch the color, feel the texture on the tongue, and especially if you're eating with hand, we also recommend eating with hand in India because it has got its own benefits. So feel the texture, observe the color, just roll the food, like we taste the wine, just roll the food around your palate. So yes, it's an excellent practice. And I think what it does, that it also cut down your time. So you eat slow, and obviously that leptin hits in, and then, you are satisfied easily. So yes, that works away. But Dr. Leah, what do you recommend about, can the elders also have the digestive enzymes, the lactase, the one you said, it is safe for them as well, like 60 plus, 70 plus?
Yeah, so as you get older, unfortunately our acid levels go down, and you need good acid levels in our stomach, and we do know that as you get older you're more at risk of getting something called B12 deficiency, and B12 deficiency can then lead to decrease in red blood cell production, and then could influence having anemia. So it's very important for the elderly to make sure that they chew their food well and get the digestion going. But there's things like digestive bitters and even apple cider vinegar, and with water 10 to 15 minutes before you eat can help increase that acid level and get the digestion ready for absorbing those nutrients. As well as I like betaine, and you can get it in a capsule form in the UK, And you can take, you basically, the way you're supposed to take it is take enough capsules until you feel a warming sensation in the tummy. And that's when you know you're at the right level. However, I think
Yeah.
it's challenging to really know
To figure
without
out the exact
the
quantities.
exact quantity and the amount that's right for you. But obviously, if you do get indigestion or heartburn symptoms, before, then that's not advisable, and make sure that you get a checkup with your usual, health professional to,
Yeah, that's a very satisfied answer. I mean, also I really like the fact which you said that poops are very important because yes, one needs to watch. I mean, do not ignore, guys. I mean, whenever you're done, just watch your poop. Actually,
Yes.
it's very important. So, moving to the second question is that what kind of fat is okay to eat? I mean, I think we meant here that, just you could throw some light on healthy fats, which one can have in every day in with their meals or without meal. What do you recommend in that?
So cooking, specifically, I know that in India you use a lot of ghee, maybe coconut oil as well, which I think is absolutely fine for cooking. You just need to be wary that you're not putting cupfuls of ghee into it, because you don't want to have it really high in saturated fat, and that's something to bear in mind. And saturated fat can impact the body, if you have too much of it, and unfavorable cholesterol, and you want the favorable cholesterol. And the favorable cholesterol, things that help with that is extra virgin olive oil, organic. And I wouldn't necessarily cook with it. I mean, if you're cooking a soup, then you can only reach a certain temperature. So it's a bit, the olive oil is stable on low temperatures, but when you're heating the pan, and it's a frying pan, and you put olive oil there, it actually changes the property of the quality of the olive oil. So actually, I recommend adding the olive oil after the meal, after cooking. So steaming vegetables, then add a drizzle of olive oil. But cook with your stable fats, which is saturated fat, but just make sure you limit it and make sure you don't add too much. And then the other, fats such as avocados, seeds, nuts.
Yeah. And what's your take on the current, this thing which is called bulletproof coffee, or, having everything bullet, which is a part of keto, but I think a lot of people are overdoing it. What's your take on that, and how healthy or unhealthy it is?
Okay, well, I'm not completely against it. For me specifically, I know that I don't do too well on coffee. So I have to, although I love it, I know that I can't have too much of it. So I definitely don't have it every day. Maybe a couple of times a week. Just I really enjoy it when I have my coffee. But bulletproof coffee, just for those of people who don't know what bulletproof coffee is where you have your black coffee and you add butter and cream, I believe,
and MCT oil, which is
MCT
a
oil.
derivative of coconut oil. So yes, you add that and then you mix it and then have it. But I think it's quite filling, although. But,
so I think it's about 500 or 600 calories or something. I don't know for sure, because it's not something that I practice. But if you're having that in the morning and that's all you're having, you're actually giving your body fat. So it's energy. And it's if it is that MCT and butter or that's mainly saturated fat. So you need to think about the other fat content for the rest of your day if you're not doing the keto processor diet. But even if you are doing a keto type diet, you want to be doing a healthy form of keto diet, because I think there's two different ones. You can be really healthy and be really unhealthy with the keto diet. So the healthy version would be lots of the omega-3 type fish oils, and the good fats such as the avocado, the nuts, the seeds, all those good fats, rather than high meat, protein, saturated fat, which can be more damaging or more inflammatory to the body.
Because I've seen a lot of patients who are doing keto and eventually they are ending up with a high LDL level, which is because, like you said, everyone is not following the exact. They are just going with the fad, how do keto and have keto and everything. So yes, Gaito, third question, what is there is then, okay, how do one deal with an unintentional weight loss, or I like to add weight gain as well, and particularly in what role does hormones play in this,
Okay, well, yeah,
particularly at the age of post 40, where
yeah.
we have a lot of hormone imbalance. So how do one deal with unintentional weight loss or weight gain?
Okay, so well, it's obviously very personalized. So you got to think about why, first of all, weight loss. So if it was unintentional, then, are you under a lot of stress, at the time? Because if you are in acute stress, you tend to lose a lot of weight very quickly. Or if you've got a heartbreak, or, that causes a lot of stress as well. So you've got to understand why. And if there isn't a specific reason why you're losing weight, or you can think of a reason, then in fact, I would always advise you to go and get a checkup with the blood tests, because it could be a thyroid issue. Maybe you've turned overactive. It could be something else that's going on in your body. And it's so important to check for weight loss. And I think that they would, do some bloods. They may do a chest X-ray as well. They may, do a colonoscopy or stool test to check your bowel movements. So that's first important to rule out any other underlying causes. So diagnoses that could be causing unintentional. And to help, to put that weight back on again, then, you want to be really concentrating on what you're eating and making sure you're adding those good fats to every meal. And the good fats, the reason I say add fats is good fats though, is because fat is a higher calorific intake. So they're the higher calorie density. So, adding a tablespoon or 2 tablespoons of olive oil is going to be up to, to your meal is going to be easier to eat than adding a whole cup full of beans and probably the same amount of calories.
Exactly.
So then you need to be adding that with good healthy food, balanced meals, and adding the good fats to each meal. And that's the way I would tackle it. Some people would say, oh no, it's way more important to get the calories in. So just it depends how much you're weighing as well, because if you're really, really low in weight, it does come to a point where, okay, getting the calories in is way more important than what I'm eating. Then, you're thinking about things like dairy, cream, all the saturated fats, ice cream even, some people suggest. I don't like to advise that, but it depends where you're at. And if you're getting dangerously low, then just getting food into you is the most important thing.
Thank you so much. And what about the hormones? So, post 40, a lot of females, they deal with, hormonal imbalances, and that also causes, unnecessarily weight gain or difficult to lose certain kind of weight. In fact, a lot of people who are doing keto or paleo or, other kind of diet thing, but they're still not able to lose weight. And what is your take about, does this have any relation with the hormones, or it's just the metabolism? What do you say in that?
Yes, I always think that there's something underlying it, and you have to take the body as a whole. So are you sleeping? And are you getting good quality sleep as well? Because it's so important to get 8 hours sleep a night to reset your hormones for the next day so that they can work properly. So if you're not sleeping well, maybe that could be the reason. Exercising, some people, I've seen it time and time again where women and men, they're like, well, I'm exercising, I'm doing HIIT training, really high intensity, I'm eating really well, really healthy foods, I'm drinking plenty of water, I'm drinking 2 liters of water a day. So these are all really important, but you tend to stress the body too much. And also there is some studies, and if you burn more than 400 calories a day with exercise, you tend to overcompensate with eating more calories than you have actually burned. And it's just the body's natural state. It wants to replenish the calories that it's burnt off, and it's feeling tired, so you tend to eat more. So there is definitely a sweet spot for weight loss. And I find that, so you need to reduce that stress. So for me, I find that especially women, I tend to, really, really draw back the exercise to low intensity exercise. So walking, brisk walking, keeping their heart rate around 120 to 145 beats per minute. So it's kind of steady state cardio. And making sure they're having the balanced meals 3 a day and not snacking, and making sure they're getting enough sleep. And if you want to do the, reduced eating times, I tend to advise eating a bigger meal for breakfast or lunch, and having a very light meal for dinner. And the studies and the evidence is that that helps with weight loss and improves the hormone function the next day.
Yeah. Okay. Thank you so much. So moving on to our next question. Could you throw some light? Okay, so in your bio, I read about your bio that you are specialized in bioidentical hormones. Could you throw some light on that and what it is? Like
Well,
what are the hormones which are bioidentical? I mean, yeah.
So sadly, you know, we all, as women, we do go through the change, but men also can get depleted in hormones as well, but mainly women. And I feel that, you know, what happens is that our eggs, we only have a certain number of eggs to release. And once we've released our last few eggs, then we go through something called menopause. And what happens in menopause is that our two main hormones, estrogen and progesterone, goes really down. And then we tend to gain weight, our thyroid becomes underactive. And then we talk about hormone replacement. So bioidentical would fit in the hormone replacement therapy category. Now, there's two different types of hormone replacement. Well, some people say synthetic and non-synthetic. Now, bioidenticals are mainly made from plants, and they basically are made in a lab from plants, and they are structured the same as what your hormones were structured as. So in theory, you will metabolize them exactly the same way. You basically detoxify or metabolize them exactly the same way that you would do your normal hormones that you would have had when you were before the menopause. Now, the synthetic or equine type hormones are man-made, and they tend to be chemicals or made from horses' urine, and don't tend to follow the same metabolic pathway as what the bioidentical pathway, metabolic pathway would have shown, followed yours. So it's really harder to measure. Plus, if you take equine, which is horse hormones, you tend to go more down when you metabolize the estrogen. It's so important to metabolize it to a favorable pathway. And I won't go into too much detail, but in the equine source of hormone, estrogen, if you get it from there, then it tends to go down the unfavorable metabolic pathway. So it increases risk of DNA and RNA damage if you've got too much of it. And there is evidence for that. So I prefer and I recommend so much more the bioidentical. Plus, the other thing to add is the estrogen. But when you're going perimenopausal or postmenopausal, it's always to have transdermally, because it's the safest way to take the bioidentical. And usually it's either E2 or E2 and E3 mix. And that doesn't increase your risk of any blood clots. Whereas if you take it orally, there is more of an increased risk of blood clots. And that's what you don't want to increase. Obviously, that does come with the risks, but you can measure how you're metabolizing that estrogen, which is great. So you can get to the right level for you and also how you feel. Progesterone, it's called micronized progesterone. You would take that orally at nighttime.
And do we have any, when we come to vitamin, mineral, in nutraceutical angle, do we have something which we can use instead of a hormone replacement therapy or, the bioidentical thing? Do we have any pill which we can pop on the lines of nutrition?
It's challenging. You won't get anything to the level of what you can get with bioidentical hormones, but there are protective. I didn't talk about protective measures and why you would take it. Obviously, it's the symptoms to help with, if you've got hot flushes and tired, not sleeping properly, because that can all happen. Weight gain can all happen if you're going through the change, and the bioidentical hormones will bring you back those hormones so you don't get those symptoms, which is amazing. But it also protects you from getting osteoporosis, and it's a cardiovascular protector, which means that when you go through the change and when you have no hormones, especially for women, you're increasing your risk of a heart attack or stroke. And if you take the hormones, especially, you need both. Well, you only need both actually if you have a womb.
Yes, yeah.
But that then also protects you from a heart attack or stroke, which is amazing. But you know, you need to be drinking 2 liters of water a day as well. And supplements wise, natural ones, there are natural things you can take to try and support you going through the change if you want to do it naturally. But the evidence that's out there about them, I don't think is strong enough to say you know, there is enough to confirm
Works.
that that, you know, that's really going to help. I do have some patients that want to go down the natural route, and that's absolutely fine. And we can try the natural route and make sure that you've got your, basically you're not got any nutrient deficiencies.
Yes.
And you know, you've got plenty of B vitamins, zinc, and then also, you know, you've got which will help with the way your body copes with going through the change, and that's so important. And you know, the rest of your metabolism and what's going on, and hormone production, as well as reducing stress. And then the herbs would be, you know, I'm sure you know the herbs like black cohosh, dong quai. There's a few of them out there, but again, there's no set, because everybody's have differently. So
Exactly.
there's no,
Everybody is different. Yeah, I know.
yeah.
That's very
But
true.
then in theory, if you take that, you still have, I would still make sure that you're monitored, because if it could have some sort of impact on your hormones. So you should be getting a blood pressure check. You should be getting your breasts, you
Absolutely.
know, checked regularly. And even I recommend a transvaginal ultrasound scan, so a pelvic scan, to look at your ovaries and your uterus at least every 18 months, especially through the change. Because it's not, you know, there's not giving you any radiation. It's really non-invasive, very easy to do. And you know, the risk, there is an increase of ovarian and uterine cancer on the rise, because in the UK it's not mandatory to have a pelvic scan. But if
Yeah.
you're on hormones, I always recommend getting one at least every 18 months. And if you are postmenopausal, I would maybe get one every couple of years, just to check, because it is on the rise, because we don't monitor it and we don't screen for that.
Yes, well, that's absolutely correct. I mean, monitoring your body, monitoring your hormones is very important. And like you said, you know, even if you are popping up any supplements, it
Yeah.
should be, you know, guided. It should be taken care of, because, like, there are endless supplements in the market, and all the entire knowledge the Google God have, and then, you know, people are just, which is very disheartening. You know, I mean, there should be proper medical advice even when you are taking any supplements, because every supplement and everything has certain kind of recommendation, and everybody is different. So yes, guys, just please be careful whenever you are taking any supplement. Do not take it without any recommendation or any advice. Yes, moving on. So okay, so we have a question which says that how do one follow a healthy lifestyle, and you know, how can we cut down the regular lifestyle medications, like, you know, the diabetes, cholesterol, your blood pressure. Do you, can you just, you know, tell us a healthy lifestyle pattern, take us through?
So I would, if sometimes it's a big change, and when it's a big change, and also everyone's different.
Yes.
Some people are, you know, very good, and they can just change, and that's it, done. You've done the change. When you see and understand why you need to change, some people are very good, and you will know if you're one of those people, which is great if you can do that. But a lot of people tend to need to form habits first. So I would take one thing at a time. So let's say if you want to work on sleep
Yeah.
first, you know, then I would work on the sleep first and get that down, and do that for a couple of weeks first, and get your routine going. And once you've got that down, making sure that you're drinking water, even 2 to 3 liters a day, and depends on how hot and how much exercise you're doing. So making sure that you're getting good quality water, and work on that for a couple of weeks. And then it may be, you know, you may not eat any vegetables in your diet, depends. So then start adding one vegetable in, you know, with your meal. And then and you will start to see that that it will start to become a habit for you. And then you know you're ready to go to the next step. Okay, what's next? So everyone's very, very different in that sense. But and medication wise, if you're, you know, my mum is actually diabetic, type 2. she's a little Asian Chinese, so I'm mixed, so I'm half
Mm-hmm.
Chinese and half English. So my
Right.
mum's Chinese, and she's very slim actually. And she's type 2 diabetic, and she doesn't fit the normal Western Caucasian person who would be
Yeah.
overweight,
Yeah.
who would develop something called type 2 diabetes. And for those people who don't know about type 2 diabetes, it's where you produce a hormone called insulin from an organ called the pancreas,
Mm.
which is released to help mop up all the sugar in your body when you eat sugar. And when you become type 2 diabetic, what happens is that insulin is not working or doesn't seem to be working properly. Either it's not being pumped out properly, or the receptors aren't picking it up to then mop up the sugar in the blood system. And my mum was started on medication, which I was supportive of, and obviously very supportive with her healthcare provider, because it's
Mm-hmm.
so important that
Yes.
you're so biased, you can't manage your family. But with the help of her healthcare provider, who was open, and my mum was open, we managed to get her off the medication. And her glucose control, the sugar control, is even better than it was when she was on the medication. So when she went for the follow-up, they were like, oh, they were so happy, because they were like, oh, what are you doing? This is great. Okay, yeah, you don't need to take the medication. That's fine.
I know.
So I was so happy that we were able to do that. And I want to say that it is possible. So to get off medication, it is possible, but you need to work with somebody who knows what they're doing, and to take you through those lifestyle changes, and to monitor and check you regularly, so that if you are making those changes and you're diabetic, that do it with a healthcare professional,
Yes.
because you need that regular glucose monitoring. Because if you change the lifestyle factors and no longer need the medication, you could almost
Mm-hmm.
drop your sugar too low.
Yeah. And
So
make yourself.
it's so important to make those changes and work together, with a healthcare provider, or your regular doctor.
So the next one here is somebody has asked that what are the good source of protein one can eat?
Okay. Well, I do eat meat, and fish, so I do think it's a very good source of protein.
Yeah.
But you want good quality, so grass-fed, organic, free range as much as possible. And I would say, if you're not a vegetarian or vegan, then having one animal source of protein a day with one meal is very important. And because protein is important for the building blocks of your immune system, but
Mm-hmm.
also for making your everything in your body. So it's so important to get that amount of protein. The amount of protein you need is zero point 0.8 grams per kilogram of body weight daily. And you don't need it all at once. You have it in your 3 meals or 2 meals, whichever you have. And if you're oily fish, I recommend you have at least 4 times a week. So they would be your sardines, your mackerel, anchovies, herring. They're your smaller fish, and they're oily fish high in omega-3. So be wary when you cook them. Don't cook them on high temperature, so you get all the
Lose the
benefits.
nutrients.
Yeah, so like it works a bit like olive oil that we talked about earlier.
Yeah.
If you heat up too much, then it can change the good property of the oil
Yeah.
that comes from the fish. And so it's really good to get that source of omega-3 for the body, for an anti-inflammatory effect, and for your essential fatty acids, which is so important for your body's function. And that will help with your source of protein as well.
Yeah. And
Yeah, go on.
no, please. I mean, after you.
Oh, so I was going to say, if you're vegetarian, then you've got eggs. If you can manage to tolerate eggs. But if you're vegan, then you need to be very wary, if you're vegan, that you get that amount of protein a day. I'm finding that patients who are vegan, that they tend to be low in B12, because you
Yes.
can't get active
B12.
B12
Yeah.
from a vegan diet. And B12
Absolutely.
is so important for
Yeah.
lots of functions in the body. And you may become anemic and low energy. You can even get tingling or numbness in the legs with low B12. So it's so important that you need that amount, or you supplement with B12. Without getting into too much detail, that's the one that you need high acid in the stomach to be able to absorb well and digest the protein well. So if you are supplementing, I would get one that you absorb underneath the tongue, because and that goes straight into the system.
Maximum.
and it
Yeah.
bypasses the liver, so then it maximizes the absorption of the B12. If you take it orally and your acid's not high enough in the stomach, you won't absorb that B12.
Yeah.
So that's something to bear in mind. But yeah, vegan
Okay.
sources. So you need to be very on it with your vegan diet to make sure you get that right amount of protein and complete protein. So
Complete protein.
complete protein. So you can look that up
22
online.
amino acids.
Yes, you can look
Yeah.
up online. There's loads of resources about, where can I get my vegan protein? But you need to, because you need to make sure that you get, because although if you don't, then your immune system can be impacted. The white cell production as well is so important. And, especially now with COVID, you want to
Yes,
make sure that
absolutely.
your immune system's working effectively.
I know, I know. So I think Kartika here, she's asking that our pulse is good source of protein, and for vegans you have already said. But yes, I think pulses are very good source of protein. But only the thing is that like we have been taught from our grandmothers that you have to soak your pulses for
Yes.
6 to 8 hours minimum to get better absorption. What do you have to say, Dr. Leah, on this?
Yes, so you might not break it down properly, you might not digest it well. So you're absolutely right. Some people buy it tinned as well. If you don't, I would try and avoid tinned food, especially if your body is inflamed, because it
Absolutely.
tends to have sulfites in that's preservatives. So it's so much better to be natural and soak them overnight and then cook them the next day. And you need to help, it basically soaks them to help the digestive system manage to digest the nutrients from that food.
Absolutely. Thank you so much. And in case, like we discussed on the first topic, that if you are not able to digest the protein, being vegetarian, the digestive enzymes do help. We have a lot of natural source of the natural source of digestive enzymes as well. So one should go for those kind of things. And also, I think, Dr. Leah, I'd quickly like to add one more thing, that the protein depends upon the kind of workout or kind of growth you have. Because kids, they need more protein. If you're working out and you're doing a lot of manual work, then you need more protein. But if you're sitting down, you might not need more protein. So yes, guys, please, that is also very important thing to watch. So moving on to the next question is, keto, gluten-free, intermittent, or paleo? Which is your favorite, and which is the healthiest?
That's a really tough one. So what's the keto or paleo, or which one was the last one?
Keto, gluten-free, intermittent, or paleo?
I think it's really tough. I'm not going to side with anything particularly, but I'm going to say that a combination of all of them is the right way forward. I don't think anyone needs to go down a specific route. Maybe the keto aspect, healthy keto, can be helpful to begin with, to reset the body, to learn how to burn body fat, especially if you're overweight and very inflamed. But then it's not, a lot of people may disagree with me because they had such great results with keto. But I find that later down the line is unsustainable. And actually your body then there's a risk in theory that it may, because it's usually quite high in saturated fat as well, but there's in theory that your body will never then be resistant to being able to deal with sugar if you are on keto for such a long time. So it's not something that I tend to recommend, and I get such good results with patients if I put them on a couple of weeks of a keto adaptive type diet and then reintroducing the complex carbohydrates. And I get such good results that and reduces the inflammation that I don't need to go and change anything else, and they don't need long-term keto.
That's absolutely correct. In fact, I tell to my patients as well that all these diets are a therapy. You should use it like a therapy. If you want to switch something, do a detox for some time. If you want to want to reduce weight, I mean, all the kind of diet should be used for what kind of results you want, but it should not be a lifestyle. It should be taken as a therapy. Do it for sometimes maximum for 6 months, then give a gap, and then again you can go back to another kind of diet or something else.
But the thing is, all diets work, but they don't. But then they don't, because people tend to go back to their original lifestyle. So I do think that it makes a difference. It's actually, you know, you can use it, and I would use it under the care of a professional, because you tend to go too much. I see it time and time again. Patients tend to take it too far, so then become nutrient depleted. It affects their gut microbiome, and it can then have negative impacts on their health, whereas they would have had
Absolutely.
positive impacts to begin with. Later down the line, they will then become negative impacts.
Absolutely. In fact, there is a research which also says that doing a diet for a longer time might shut down your endocrine and mess with your hormones as well, because the body will think that you are not getting enough calories to it'll stop all the other system to protect your digestion or to protect your body. So
Yeah.
yes, you might shut down your other system if you're not having the calorie or the food which is required for your body. So yeah, moving to the next question, we have a question about what do you recommend about kids nutrition, and particularly during this COVID time, what are the things which they should be having it every day to keep their immunity strong and also to keep their mind active as well.
Well, so kids are challenging, aren't they? Because it's
Yeah.
like they you can't, especially when they don't like something. And I would never force a child to eat. You know, as a parent, I'm not a parent, but if you tend to say, "Oh, you must eat something," they tend to like act up, and then there's a definite no, and then it might be a
Yeah.
tantrum. Also, so I would never force a child. I would make sure you put it on their plate and have meal times with them. So, that helps, I think, together. And if they see you're eating it and everyone else is eating it, they're
They
more
will eat it.
inclined to try it, maybe, and then they might start liking it. And no, you know what? No one likes change. So they're used to the foods that they were originally given sometimes, and then
Yeah.
they don't like to try new things, because who likes change? But naturally, I think
Absolutely.
human beings don't like it. And I would avoid the sugar. So kids do need enough calories. So I would treat it very almost like what we talked about earlier, getting plenty of vegetables, good sources of protein, and making sure they're hitting, like, getting their protein content enough, having it with each meal, especially with their growth. And but sugar, I would avoid the sugary snacks, and try and get them to eat healthier snack options. So even like hummus and carrots or something
Yeah.
like that, or something that's wholemeal, with the hummus, or a dip or something as a snack. Some nuts, if they can eat nuts. It is challenging, I agree. Or a piece of fruit, a piece of fruit with peanut butter or something like that, if they like that. Blueberries, and in the UK it's berry season, so we've got a lot of berries, and kids tend to love raspberries and strawberries and blueberries. So that's a
Yeah.
really good way of getting their antioxidants up and a vitamin C. But I
Perfect.
would probably, look for a good quality kids vitamin, so that you can support their zinc levels as well, and their, vitamin D if they're not getting the sunshine, especially during, the COVID pandemic.
Yeah, that's absolutely right, doctor. Because during this COVID times, the midst of the pandemic, we are I mean, mostly kids. They are sitting down home. They are having the pack of chips, or convenience eating has become a part of our routine.
Mm,
But nutrition is very important, because all the certain kind of things, laziness, mental fogginess, are
mm,
the result of excessive sugar and the convenience eating. So yeah, I think you have covered the entire thing, that you supplements, vitamins, and your kids' nutrition is very important. Colorful fruits in India, we have
mm.
mangoes, which is also full with a lot of antioxidants and vitamin C. So yes, food
There's a
and
lot of natural
vegetables.
sweet things that
Yes,
they can
yes.
eat, basically,
So
other than
yeah.
the actual sugar or the sweets that you can buy. Yeah, for sure.
Exactly, exactly. Thank you so much. So, again, somebody has asked us about anti-aging, and, what should one do? I think everyone has read your profile very carefully. That's why these questions are. Okay, so anti-aging, and what should one do to age gracefully?
Well, I think hormones help for sure. Hormones definitely help, but it's getting that balance of life right, and not getting, if you need sun exposure, but the face you need to protect. And there are things that, that's not medical, that's more, I suppose, aesthetic. There's LED lights now, there's laser
Yeah.
you can get, and there's things that can boost your collagen production. But I always say that you need to start from the inside. So you must always have your digestive system healthy before, that then, and reducing inflammation in the body, then that
Yeah.
will help you age gracefully. If you are inflamed, if you're drinking alcohol, if you're eating saturated fats, and crisps and fried foods, then and lots of refined sugars like white bread, white pasta, this is going to lead to aging poorly.
Fast aging, yes. And also processed food, which is,
Yes.
a lot. Yep.
Yes.
Okay, so I think our session has come to end. I'll quickly see. We have a lot of questions out there. Soon, somebody has asked that yes, the keto diet isn't recommended for South Asian population. Okay, that's. I'll just go through the questions quickly. Okay, so here's the question: how to get all the nutrients and build your immunity if you are lactose intolerant?
Okay, well, lactose intolerant, for those people who don't know, is when you eat, is difficult to break down the lactose in milk, which is a sugar. So if you can't, and milk and dairy products can have lactose in it. So you can take an enzyme, so you can take lactase, or you can get a milk version, which is in the UK anyway, for sure, you can get the milk that's got lactose removed. So you can have it. So it has all the benefits with the calcium that you need. But what was the question was to do with protein, was it? Or
Okay, I think immunity, overall immunity. Build your strong immunity if you are a lactose intolerant.
Oh, okay. Well, then, that's only calcium. So making sure that you're getting your calcium
Yes.
intake. And then we talked about immunity earlier about the protein. That's anything to do with dairy. So, lactase is mainly to do with milk and breaking down lactose in milk. So I think we're good with that then. You're
Yeah.
good with following.
So, yeah. Another question we have is, hope you are at the pink of your. I just want to ask that is weight loss entirely based on weight loss diet healthy? I didn't understand the question here. Well, the question is not very clear. The next one we have is my mother-in-law, who is 82 and had ovarian cancer. She recovered and had a stroke. So my question, what is the question, Deepika? You have to be clear that what you want to ask. Okay, that's really sad to know, Deepika. I'm sorry about it. But if you have any question, please be more precise.
You could look up online. There's some things you can do for the brain that's really healthy. So good fats, the brain needs good fats to function well and repair. So that might help. But I'm very sad to hear that. But, nutrient-wise, making sure that she's getting all the nutrients that she needs and a lot of good fats in the diet. So there are things you can look up for brain health and brain function to improve and support.
Okay, we have another question. What blood test to be done to keep a check on all the nutrients and which are there in our body? Okay, which are there in our body?
So you can do lots of blood tests, and what they tend to do, you can check all your B vitamins and even vitamin C. They have to spin the sample, and it can be very expensive. So it's not something that I generally do very often. What I tend to do is I mainly take your food diary and I then look at it over a week and I analyze how much nutrients you're probably getting from your food to then think, okay, maybe you need, and also take into account your clinical symptoms to then decide, okay, you're probably lacking in these, and these. So, and give you a course of supplements and see how you feel. And that's usually how I do it. But you can also do, I don't know about in India, but you can also, you can check your B12 and folate, which is a regular thing that I check, and vitamin D. But the rest of the vitamins like B's and C's and everything else, I don't tend to spin it down to see how much it's got in the cell because it is very expensive. But you can do it if you've got the finances. Then I think go for it, get tested. Why not? And the lifestyle.
In fact, we have, we at our place, we do a lot of micronutrient and macronutrient testing, and we also have genetic DNA testing as well. So these are also the method, if you really want to find out
Yes.
what exact quantity you have. Apart from that, Dr. Leah has said that, noting down your nutrition level is very important to.
You can do those as well in the UK as well, the functionals tests. So I'm talking about medical tests, but I would say functionals are integrative tests, which aren't regular conventional medical practices. You can test more micronutrients like heavy metals, all those things in the urine or in like the hair as well. So you can check those. So it is possible to get more of a breakdown and something more precise.
So guys, if you want to get in touch for your blood test and all, you can always DM me, and we have all these facilities. We have another question, that what supplements can be taken, if at all, that can help in hormonal pigmentation? Okay.
Oh, that's a challenging, because actually if you take hormones, I would try and understand what's going on behind your hormones. So I would do the genetic check as well. And if you sometimes it depends what the cause is. So you need to find the root cause of the problem. But there are certain creams that you can use as well, and making sure that your gut health is healthy as well, and you're getting rid of those excess hormones if it's an excess hormone issue. Some women get it because they take the pill, or I think as you're mainly increased risk being of an Asian ethnic background, you get the pigmentation, I think, as well. And I do feel that there are skin treatments that you can do as well to reduce that pigmentation.
I think in polycystic ovary and these kind of thing, I mean, people do get a lot of pigmentation because of the imbalances. I think balancing your hormone is the right way with your lifestyle modification, and then going for other kind of
aesthetic. Yeah.
Yes.
But you need to sort out the inside first. Yeah.
Exactly. And I think, Dr. Leah, the safest thing to supplement yourself with vitamin C to start with is absolutely safe if you don't have any kidney problem. I think I think that's
And
one thing that one can do it.
And you don't have too much iron. So
yes,
that's so important. If you have too much iron in the body and you supplement with vitamin C, the iron can go even higher, and then it can make you feel really unwell.
Absolutely. So, our session has come towards the end. So one question which we had just popped in our DM, which is, one of the best advice you can give for nutrition, and particularly during the lockdown, which one can follow and get good results.
I would get your exercise done early in the morning. I know it's not nutrition, but I'd get your exercise done earlier. But I would have a bigger meal earlier on in the day and have a lighter meal in the evening, and drinking 2 liters of water a day. I know that seems, and I know we've talked about the other things about cutting out sugar. This is presuming that you've taken out the sugar already.
Yes.
But it's so challenging to give one simple answer, because everyone is at a different stage in their nutrition life than everyone else. So I would say just making sure that you're cutting out the sugars and eating balanced meals, and have your meal, I think, earlier on in the day, and getting that sleep quality and drinking water. So that's what I would say, especially during these times.
Perfect. Thank you so much, Dr. Leah. It was fabulous talking to you, and we'll get in touch very soon again.
Thanks so much.
Have a great afternoon there.
Yeah, thanks so much. It's been lovely chatting to you. Take care.
Bye-bye. Take care.
Bye, thanks. Bye.
So yes, friends, that was Dr. Leah for you. And, I'll quickly like to end our session with our last question, which was a nutritional advice. Like, she has given a lot of nutrition advice, changing your sleep pattern, watching your sleep, adding a lot of nutrition to your food. Apart from that, I have always told that, vitamin C, your zinc, vitamin B12, sunshine vitamin or vitamin D3 is very important. So please take good care of your health, get your supplements, have your food properly, get the sleep, do workout, and have fun. I mean, just enjoy, don't take stress. and meditate, do yoga. Okay, guys, thank you. Have a great evening, and then let's catch for the next session. So this was the end of chapter 10 with Dr. Leah Austin. Thank you so much. Till bye bye.